Hi everybody. Um, this is some of the new talks that we are starting on our channel, and this is to aimed at trying to help the younger crop of doctors and surgeons and aesthetic physicians to improve the practice and to try and establish themselves. So this will be a short kind of a presentation, not presentation, just a quick point of view of what you can do. Yes, times are bad right now because of the COVID and situation, and many people are feeling that yes, they might not be able to get back into their regular practices and might not be able to get to the level that they want to or where they were before. Yes, to make it a certain point, yes, it's not going to be the same, and there are going to be a lot of changes that are going to happen in what procedures you do, how you do the procedures, and even how you're going to manage the patients before and after. So, yes, there are a lot of changes that are happening. And yes, we have slowly started opening up, and we are seeing patients now, and we are trying to schedule in. But along with certain riders, so we have our set protocols that we have made, and we are strictly following those and trying to get the patients to follow those as well. So many of you might feel that yes, because right now the situation is such that people may not want to, you know, think of it as a luxury and may not want to try and get into something aesthetic or do a aesthetic procedure. But yes, for the time being, yes, maybe since they cannot get out. But when you come to see that many of the procedures that you're doing, which are so called aesthetic and so called cosmetic and so called superfluous, are actually not. When you're dealing with aesthetics and when you're dealing with patients and personally also, doing these procedures are essential to a certain extent to people because it does help them during their work, it helps them in their confidence levels, it helps a lot of things. So that is why these procedures will still be in demand, but yes, maybe not at the same level as it was before. So only people who are actually um, needing it for their work and for their day-to-day activities will come in. But yes, it's not going to go away. People will still come, and there will still be a demand for it. Now, the whole question is when you're starting an aesthetic practice or when you're setting up an aesthetic practice and you don't know what to do, and you're wondering where do I get the patients from, where do I get this thing? There are a few things. Once you have your own set of patients and you already have a practice which is running, then the best thing that will happen is you tap into your old patients. Okay, you let them know that they are open, that you're open, but yes, guide them properly as to what are your new protocols and what is the way that you're going forward with it, and what are the requirements that they will have to ensure. And of course, you will also have to tell them about what you are doing to ensure that everything is working smoothly and you're ensuring their safety. So once you do that, then yes, you'll have patients who will start trickling in. The other thing is, it's like people, all of us haven't gone to for a haircut in the last 2 months. So everybody's hair is growing all over the place, and so it's a similar way with other things as well. So be it your facials, be it your PRPs, be it your Botox or your fillers. So yes, somebody who's been doing it and they know that it helps them, so they will be coming back. But you have to tell them that okay, this is what it is. These are the things that we're going to do, and these are the things which are possible, and these are the restrictions that we are not going to do. So give them a fair idea about what you are and what you're doing. So that will help. Secondly, is yes, as I said, after reaching out to your old patients and informing them that yes, you are open, and along with these following protocols that you have to follow. Then another thing is social media. Right now, because most of the people are at home, so use your social media, use your channels, use your Instagram, use your uh, Facebook and all, and start putting up posts and telling them that yes, you're open. So letting people know. Another way is to talk about common problems that you know that people are facing nowadays. So you will see when you're at home, okay, like hair loss, or depression, whatever you're dealing with, you can start putting out skincare tips, something of that sort. Start telling people that okay, yes, you are there and you are available, and these are all the problems that everybody's facing. So yes, you need to you need to start looking out of them. Yes, corona is one thing, but now the phase has come where you have to learn to live with corona. Okay, it's not going to go away, and from what you hear from the WHO also, the recently, that most probably it might never go away and might stay on, like how AIDS is staying on. It might be like an endemic disease which is already there. So you just have to learn to live with it, and it's not possible for everybody to just shut down. But yes, you have to follow the norms. You have to do the social distancing and all those things, and the mask, and even in the clinic, you have to maintain that. So, as I said, first is old patients and inform them about this. Then, second is you can go onto social media and talk to this. Thirdly, is put out relevant information. Okay, talk about relevant things and tell them about what you're up to and what you're doing, and any new offerings that you have. Okay, put out emailers. You might have your list of all the patients that you have who have come and visited you. Put out emailers. Okay, tell them that okay, these are the things that are services which are now active, and these are the things that you can get in, and this is what you can do. And people have got to have confidence in what you do. So talk about it in such a way and put out some of your results, because now people are starting to get out. So as I said, put out some of your results, talk about certain procedures that you're doing, so that people get confidence, okay, that yes, these things are not one off, and it's not that they are the only ones who are thinking about it. There are others who are already doing it. So that will also help bring in patients, and they will also start asking and inquiring. Put your numbers out where people can find your number and get back to you if they have a query. Teleconsultations, many of the doctors have already started. You can still do that if you're on some of the teleconsultation helplines and all that. You will start getting queries from there as well. But the main important thing is you have to put it out there that you are available for consultations. And once you have it, if you're not able to do a teleconsultation, then along with the necessary precautions, you can start doing your regular consults as well. And once the patients come in, talk to them. Okay, talk to them, make them feel that you know you are listening to what they are saying, and it's not just another regular patient seeing, where you just patient comes and you see him and then you see something and then you write it and you tell them to go. So do that. Okay, so be active, be proactive in the community as well. Okay, so try and put out some information booklets and about your clinic, about your services, and what is possible, what is not possible. And so you have to be out there. Okay, you are the face of your business. Unless people don't have a look at you and they don't know who you are and what you're saying, it is very difficult for patients to come in directly. Okay, especially in certain times like now. So even if you are a novice, you have not had any exposure, which is highly unlikely. But even then, if you have not had any exposure, please get on to all the social media channels that you can manage. Okay, and start putting out relevant content. Okay, talk about things that are actually needed right now. Don't talk about unnecessary things which are not even people are asking for, and they're not interested in. Okay, so you will know by your practice how your practice works. What are the patients that are coming in for? What are your normal usually patients? Seasonally, what are the patients that are coming in? And now people have been stuck at home for the last 2 months, so what would they be expecting? So all that. So you have to talk to them and get out your information out there and tell them that it is safe to be doing it, and you are also doing all the necessary steps at your center to keep everything safe, keep the staff safe, and keep them safe, and that will also help. And then, of course, most of you are associated with some of the other clinics or hospitals, so try and get in patients from there, and let everybody know that yes, you are available. That is the best thing. So as if you know what you are doing and where you are in this point of time, so social media is your best friend. So get onto it and get going. Apart from that, of course, your regular referrals from other doctors and all that will be there. But because of the present situation, I think the best way is to try and go direct to the customer or the client, and that will have to be through social media, because you can't directly go social media and your emailers to your old patients, and you can also send them with messages, and some of your close ones, you can even call them up and talk to them and tell them that you're open with all these necessary precautions that you're taking. But as I said, start in a graded manner, don't overdo things. And aesthetics is, it's a bit of a tricky situation, so you have to be careful about what you say and what you do and what you offer. And yes, people are going to come, it's not that, so don't have to be worried. Might take a little time, but start putting out your information in this thing, and when the patients come, treat them well, look after them. And that is true for all times. Okay, your patients are your best advertising. Okay, so if you look after them well and if you do more than what is promised, then they will always come back and they will send you other patients as well. Okay, so be truthful to what you do, learn the right way to do things, do what is right by the patient, and also put out proper information, and stay away from gimmickry and hypes and all those things. Patients can see through that. Okay, there will be a small subset of patients who will just go just because of the hype and everything, but don't do that. And take this time to improve your interpersonal skills apart from your medical skills, and how you're going to present to the patients, how you're going to talk to the patients, how you're going to give them better ideas. And in this time, as you start growing, and if you, this is the best time, if you're not been on any other channels or this thing, this is the best time. You have to go digital. So get your social media online. Okay, so you have the time now. Get your Facebook page, get your Instagram page. Start putting out relevant things. Don't just follow the rule and just see what others are doing and do the same thing. No, put out something unique to you. Put out something that is unique to you and what you are and what you represent. That is the best way to get clients. Because if it's the same repeat of what every other clinic is going to be doing or putting out, then there is no sense. So you are an individual, you are your own face of your company or your brand. So look out for that and talk about that. And getting onto other companies, and they doing their work and everything is okay to a certain extent, but then you lose out the touch because it is not you, it is the company who is doing it. So then you're not true to what you want your brand to be. So please do that. Okay, get get online, as I say, get digital, and make your presence felt. And the best way is to go directly to the patients. So that is the best way. And once the people see that yes, you're putting out good information and true information, and you're staying away from gimmickry, that itself will grow your brand, because it's a slow process. It doesn't happen. There is no way that somebody will tell you that okay, you just get on, do this, and then next day you will have about 20 patients standing in front of you. No, that doesn't happen. It's a process. So you have to do the process, and this is a good time. You have the time to build it up, but build the basics right. Do it right from the beginning. Only then you continue the same thing, and that is how it's going to improve in the future as well. And if you have any other doubts or if you have any queries, let us know. You can get in touch with us. We'll try and help you out whatever way we can. And if you want something specific for your clinic or your brand, you can let us know that as well. Okay, nice talking to you, and I'm sure we'll have more people coming in and asking for queries. Please mail us. Thank you.